Hello, I'm Joy. I'm a certified professional midwife licensed in the state of Texas, and I thought it was very important during this time of quarantine due to the coronavirus concerns that I make it available for women to be able to have childbirth education classes online. So this coronavirus is affecting so many, and especially those families who are having to transfer or choosing to transfer from the hospital into midwifery care, either to give birth in a birthing center or home birth because of the concern due to the coronavirus, or families who were already planning a birth naturally with a midwife, but now their childbirth education classes have been canceled, so they are feeling like scrambled and unprepared. So I thought it would be a good idea to record these childbirth education classes so families will be able to access these and still feel prepared and informed and ready for labor. So I just want to start out by talking about how to choose a care provider. So obviously I'm a midwife, but that is not for everyone. Some women are high risk and need to give birth in the hospital because midwives only care for low risk, healthy women and babies. So, or some women feel more comfortable giving birth in the hospital. So really it's important when choosing where to give birth. The most important thing is choosing where you feel the most comfortable. So you want to pick a place where you feel like you can relax, where you feel safe, where you feel like you can trust your care providers, where you're getting really good informed consent, where you're able to make the decisions for you and your newborn. So really that makes such a huge difference. So really keep that in mind when you're interviewing different providers or different doctors, different midwives, that you go with the person, the care provider that you feel the most comfortable with and the environment that you feel the most comfortable with. So that's super important. And do your research. Learn the laws in your state and what different care providers can do, the extent of their practice, and read their reviews, talk to people that have given birth there. Do your research to the point that you feel confident in your decision. So let me start out by showing you a few different books. So these are some awesome resources that I'm going to be using to go over this material. And this course is mostly just going to be focused on out of hospital birth because that's obviously what I'm most experienced in. But if you're choosing to birth in the hospital, this may not be the right course for you, but you can still learn some great information, and you may want a class that's more geared towards giving birth in the hospital. But let me show you these books. This is called The Birth Partner. This is by Penny Simkin. This is a really great resource for either doulas or dads, moms that you can read together. It has just really excellent information on different comfort measures in labor. It has a lot of positional advice for labor, like different things you can try in different stages of labor. So this book is really such a great resource, and it's really easy to understand. It's clearly written, not overcomplicated. It has lots of good pictures, like for instance, these are some different positions you can try for labor. So it's just very clear and easy to understand. So I like that book a lot. And then this is a good book for doulas. It's called The Doula Book. And this book is just a great resource teaching you how to give good support during labor. If you're a doula, or maybe as expectant parents, this would be good when you're trying to choose a doula. So you're trying to figure out which doula would suit you best and be able to support you the best. So this is a great book for kind of understanding the role of a doula. So let me give you a quick synopsis of what a doula is and what they primarily, their role is. A doula is basically the emotional and physical support of the birthing mother. And so that is not to replace the role of the dad by any means. Mostly, actually, this is to support the dad and to help him know how to support the birthing mom during labor. So most dads find doulas so helpful because dads can feel really scrambled and not sure, maybe they're sure in early labor how to support their partner, but as labor progresses, they get tired, or she has different needs or wants, or things are changing quickly on them. And so it can be really difficult for dads to know just how to support their partner. And so this is just really helpful to have a doula that can go, hey, why don't you try this position? Or, let's get a snack, or let me rub your back. And doulas are just so important, especially during early labor, is what I find. Because really early labor is that part where moms are going to be laboring at home and before they're really in good active labor, which we'll talk about the stages of labor here in a minute. But it's so just important for the doula to be there to help the mom start to get comfortable and kind of sink into labor in that early part where, it's really not time to come to the birthing center yet, or it's not time for the midwives to come to her home, whichever you're doing, home birth or birthing center birth, or going to the hospital. But doulas can just help you kind of settle in and get comfortable. And then once you get to your final place of your birthing place, then the care providers can give you lots of good support. But during that early time, it's just so helpful to have a doula that can give you that hands-on support and kind of help you get settled and relax and help dad know how to best support his partner. So that's about a doula. And then let's see, this is another great book. It's called The Doula Guide to Birth: Secrets Every Pregnant Woman Should Know. This is another really good resource. And again, this is similar to the other books. It just has more tips, has a lot of emotional support and techniques that you can try. It really walks you through all the different decisions during pregnancy and birth. So this is a really good one. Let's see. And then this is the last one here, the Nurturing Touch at Birth. So a labor support handbook is what this is called. And so this is really great at showing you, this is showing a certain position, side lying, and it's telling you what that is really good for. So the advantages, the disadvantages of every position. So this book is just awesome for giving you lots of good ideas. Even if you're not hiring a doula during that early time of labor, even if you are when you get into more active labor, getting ready to come to the birthing center and give birth, this can just help you kind of know what positions that you can try and what their advantages are. So so now let me talk about the different stages of labor. So I kind of briefly mentioned, early labor versus active labor. So really, let's start with early labor. So a lot of times when you hear about births being the really long, 30, 40 hours, the majority of time, that is not all what we would call active labor. A lot of that is the early portion of labor. So that early labor is when contractions are maybe every 10, 15 minutes apart, 20 minutes, even an hour apart. And they're starting to get more painful, but they're not where you have to stop and breathe through them and really work through them. They're still to where, for the most part, you can talk through them, or you may stop and breathe a little bit, but they don't just take your breath away. You're not working super hard during that early part. So it is really important in early labor to make sure that you are taking advantage of resting. So especially if it's at night. So I see this sometimes with especially first-time parents that they'll start laboring in the evening, which is very common because basically labor is the result of hormonal reaction. So you get this hormone oxytocin, the love hormone, when you're, at night and you're resting and it's dark and you're at a place of peace, then your body decides it's a great time to start labor. And so typically contractions start up in the evening or in the middle of the night is what you hear the most. And so sometimes what first-time parents do is whenever those contractions start, it's still very early labor, but they get excited and the mom might get up and she'll walk the floor all night and try and get things going, and she'll walk all night and then maybe all the next day, and then she'll get into active labor by maybe the next night even. And by that point, she's been up for 24 plus hours and is completely exhausted. And it's really difficult to have a natural labor if you've already been walking the floor 24 hours during early labor and then just starting active labor in that very tired place. And so it's really important that whenever labor starts, you do what's appropriate for the time of day. So if it's evening time, just doing what you would normally do, trying to take a bath, lay down and rest. And even if you're still contracting, maybe even every 8-10 minutes, trying to just lay down still and rest, or sit on a yoga ball or a birthing ball and turn the lights off in your room, put some pillows on the bed, forward lean, and just trying to rest even between the contractions. So it's not the best sleep that you're ever going to get in your life, but it is so different than just staying up and walking the floor all night long and then starting active labor after that point. So even if you're only resting every 8 minutes and they're more like little cat naps, you're total maybe getting 2-3 hours of sleep, which just in the long run makes a huge difference in labor. So, but if it's during the day when labor starts, obviously you can get out and you can walk around, and it's really awesome that if it's during the day that labor starts to be in upright positions. So upright positions are really effective at encouraging regular contractions. And so being upright is really a great way to get your body to go from that early labor into more of an active labor pattern, which active labor typically is whenever, for first-time parents, whenever contractions are every 3 to 4 minutes apart. And that is when you're timing them from the beginning of the first contraction to the beginning of the next. So every 3 to 4 minutes apart, lasting a good minute. And for that pattern to have been going on for an hour or two, and for you to start having more intensity with contractions. By the time you get to active labor, you're definitely going to be stopping to breathe during them. You're not going to want to be talking during contractions. You'll probably want to be moving with them, swaying with them, breathing with them. And so at that point, that is when you're in active labor. And typically active labor, according to dilation, you're about 5 to 6 centimeters dilated. So let me talk to you about dilation and cervical change real quick, and then we'll get back to the stages of labor. But so most people, when you think of progression in labor, most people just think of dilation as the one marker that is the kind of tell-all in labor. And even though dilation is used very frequently to assess where women are at in labor, it is definitely not like the only thing that we're looking for, or the only way that you can tell where women are at during labor. So there's so many other signs and ways that you can tell, but it is an effective tool to be able to kind of see where women are at in labor. So prior to labor, your cervix is, I like to describe it like this. It's about this long, and it's thick, and it feels like the tip of your nose. So it's hard like the tip of your nose. And it's typically pointed posteriorly, so back towards your tailbone. So that's before labor starts. And as you get closer to laboring, your body begins to efface. So your cervix effaces. So what that means is as baby gets lower in your pelvis, baby starts to put pressure on your pelvis, on your cervix. And as your cervix has that pressure and hormones start to work, they soften your cervix. So your cervix goes from being, like thick and hard to it starts softening and it starts effacing, which is thinning out. And so as it thins out, it goes from being long like this to shorter and shorter because it's becoming thinner and thinner and softer. And so it has to do all of that work as baby gets lower, as your hormones soften your cervix, and as baby applies pressure to your cervix. So all of that happens, and then your cervix gets to the point where it's like paper thin. And by the point it's paper thin, then it starts to open. So that pressure from the baby's head behind the cervix starts to make it open, and that's what dilation is. It's the measurement of how open your cervix is. So some women get discouraged when they aren't as dilated as they thought they would be, but they're not taking into account that their body has already done so much work softening their cervix and thinning it out, and then their body has already started to dilate their cervix. So that's like a whole combination, and it takes all of that to get your cervix to dilate, and then for baby to continue to put pressure on their cervix, regular, frequent contractions, that all has to be working in sync for a baby to come earthside. And so the more frequent, stronger contractions that a woman has, that pressure comes from the top of the uterus, so that's like right here at the fundus, and pushes down, putting pressure on the baby, and then that puts pressure on the cervix. And then we're also looking for, when we're doing like a cervical check, we're also looking for how low the baby is. So you may have heard your care provider say that your baby's head is engaged, maybe in a prenatal appointment, and that basically means that your baby's head is locked inside the pelvis. And so that is, according to station, that would be a 0. Anything higher than that, so when your baby's head is still really floaty above the pelvis, then that is a minus, so -1, 2, 3. And as baby during labor begins to get lower and lower, the baby gets +1, +2, +3 until we're eventually starting to see baby's head. And so labor is the process of all of those things working together to bring baby earthside. So don't get discouraged if you don't feel like you're as far along as you think you are, because there are so many components that have to come together and work together to, get your body to have this baby. And so it's a process, and be patient, and it's really important to trust the process and to not feel like it's happening too quickly or too slowly, but just to really settle into however your birth is occurring. So that's really important. So let me go back to talking about early labor. So early labor, when you start to be in early labor, that means you have gone from, you may be just having Braxton Hicks, which are these like little practice contractions that you'll have throughout your pregnancy. You'll get Braxton Hicks, and that is just tightening of your uterus. So throughout pregnancy, your body starts to tighten your uterus just to get that uterus worked out, so that when you do go into labor, that uterus, which is a big muscle, is effective at pushing the baby out and having good, strong contractions. So toward the end of pregnancy, you may get to where you think you're in early labor because you're starting to have contractions that are timeable or maybe even a little bit painful. And the difference between that, which we would call false labor, because it's not yet making cervical change, and early labor is what your cervix is doing. So in early labor, your cervix is beginning to make change, whereas in false labor, they're just more of those practice uterine contractions, but your cervix is not yet making change as a result of that. So a lot of moms ask me, well, how will I be able to tell when I'm in labor? How will I be able to tell because I'm having lots of uterine activity? And how can I tell between the false labor and the early labor? So really a huge difference between false labor and early labor is that in early labor, as opposed to false labor, the contractions get stronger, longer, and closer together. So they start to develop a pattern, and that pattern becomes stronger, longer, and closer together. And you may take a bath, or you may try and get some rest, or do all these different things to slow it down, but your body will continue to, maybe you'll lay down and they slow down for a bit, but then as soon as you get back up, they pick back up and get stronger and closer together and longer. So, whereas in false labor, they may go on for a while, but they don't increase in consistency. They're not any longer. They're not really getting stronger. And you may take a bath and they completely go away. And then, later you're active and they come back. So that's a really great way to tell if it's truly labor or not, is if it's making consistent progress. So if it's getting stronger, longer, and closer together, if the contraction pattern is. So that's a really great way to tell. So when you begin labor, you may notice that you have increased discharge. So that's really common. You may notice that you have what we call bloody show, which is basically just blood-tinged mucus or actually pretty bloody mucus, and that is a result of cervical change. So when you start to have cervical change, it's really common for you to also have spotting with that cervical change. And the increased mucus is due to the mucus plug, which your body creates in your cervix during pregnancy to basically protect your baby from being able to get like different bacteria or infection. It's basically just a plug in your cervix that is a barrier protecting your baby in your uterus. So as you get closer to having the baby, you may notice that you're having a lot of increased discharge, and that's really normal and not necessarily a sign that you're like just about to start labor, because you can lose the mucus plug and then it can regenerate. So, but it's more of a sign that you're getting closer to labor if you're starting to have that bloody show, that pink discharge. So that's really normal. And it may start just in early labor and you may not see it again, or it could be all throughout labor that you continue to have that bloody show. So if you're ever concerned about the amount of bleeding, if you feel like it's too much, or if you're having that when you're not yet term, like if you're earlier than 37 weeks, always contact your care provider and let them know, because that is more a sign of labor. Occasionally women will see some spotting later in pregnancy or at a different point during pregnancy, and they'll see that after intercourse, and that's not necessarily a sign that labor is starting, just more because their cervix, was moved around, or after you have a cervical check, you may see some spotting, and that's again just because the cervix was disturbed. So but not normally a sign of labor, but it definitely can stir up labor. So, so let's see. So in early labor, it's all about just getting comfortable, trying to get used to being in labor, practicing your breathing. So this is something that is really important during labor. You have to get to the point to where you're completely relaxing your whole body. So it's really important even to start with your head and just relax every muscle as you have a contraction. So your body is really strong, your muscles are really strong, and you can really hold a baby in or push your baby out with those same muscles. So if you are really tense and really tight, it will greatly slow down your labor. So as a contraction starts, it's really important to especially relax your jaw. If your jaw is clenched, it's very difficult to clench your jaw and not also like hold the muscles in your pelvis at the same time. So if your jaw is tight, your muscles in your pelvis are probably tight as well, which can really hold a baby up if you think about it like that. So really relaxing your jaw, and then your shoulders are the same. If you're holding up your muscles, it's really hard to hold up these muscles and then relax your muscles below, So really relaxing your jaw, relaxing your shoulders, and trying to let every muscle go as you have a contraction. And really, as you feel that contraction starting, just to start to breathe out and continue to slowly take deep breaths. Inhale and exhale, deep, slow breathing, and continuing to keep all your muscles really relaxed as you go throughout labor. So it is really so important and makes a huge difference in even the length of labor and how labor progresses, just how well you can really let your body relax and just let baby move down. And you're gonna feel lots of new and different sensations, especially if this is your first baby. But you just really have to give into that and just let baby move down. Really accept those new sensations that you've never felt before, and just really relax as you go throughout labor. So really breathing is one of the most powerful tools of going through natural labor. So you can control so much with your breaths, and it is so helpful because it really takes you from a place of feeling like maybe you're out of control. If a contraction comes and you're just breathing in response to it, or if you're really feeling that contraction come and taking control of it and really controlling your breathing, it gives you so much more control over what's going on versus just responding to a contraction. So that is so important throughout labor, and really just letting all your muscles go. So that is huge during labor, and you should continue that as long as you possibly can. So some different positions that are awesome for labor. So in early labor, if it's, during the day, you've gotten a little bit of rest at night, then you start labor in the day. Some positions that are really great, you can walk the stairs. So walking sideways down the stairs while you're holding on to the banister, and then as you get a contraction, you put your leg up that's higher on the stairs, a couple steps up, and lean into it. And then you're obviously going the other direction, so you're staying even. But that's really good at, first of all, encouraging more frequent contractions and giving baby lots of space to move down in your pelvis. So that's really awesome during early labor is the stairs. You can go curb walking, which is again where you're walking down the curb, and it really looks like this, where if this is you're putting one foot up on the curb, walking on the street, one foot up, walking on the street. So you're doing it basically like that, and then you're turning around and doing it the opposite direction. So it's just helping your pelvis move in this direction and allowing baby lots of space to move down. Squats are great during early labor. Lunges are great. So really being as active as you can during early labor is perfect. You can sit on a yoga ball or a birthing ball and do what we call figure 8 circles with your hips. So that's just what you would imagine doing a figure 8 with your hips. So that's really good. Or bouncing on the birth ball is perfect. You can do, as you get, further along in labor and you need a little bit more support, you can do what we call a supported squat or a dangling squat, where you're holding on to maybe the banister and then you're flat-footed and squatting down during the contraction into a squat and then getting up between and squatting back down during the contractions while you hold on. Some people really use their partners for a lot of support during labor as they get into different positions. So they may slow dance with their partner, or they may hold on to their partner's neck as they lean forward, or their partner may sit behind them as they, rest their arms on their legs and as they're in a squat. So really whatever's comfortable for you, but something that's upright, that's active is so good during early labor. And then as you get closer to active labor, you may need to rest for a little bit, and it's fine to balance that activity with rest. You don't want to just completely wear yourself out either with the activity. So if you're needing to rest, like I said earlier, if you want to sit on the birth ball, stack some pillows on the bed and forward lean to rest, that's perfect. If you're going to lay down in the bed, laying on either side, and then you can stack pillows between your legs, or use what we call a peanut ball to kind of prop up your leg to keep your pelvis open. So it's important if you are propping up your leg while you're sidelined that you're also, in addition to propping up your knee, you're also propping up your foot. So I've seen some people just prop up the knee when they're side lying on the bed, but that really, if you think of the pelvis, if you're doing that, you're actually closing the inlet of the pelvis. And so putting the knee and the foot elevated keeps the pelvis open. So that's really important to do. So, and then as you may use the tub in early labor, but you may find that it slows things down, which could be good if you're it's night and you're trying to go to bed and rest. The tub can be great for kind of slowing things down during early labor. But if it's the daytime and you're wanting to get things going, the tub can really slow things down in early labor. So in my opinion, I think the tub is kind of better saved for when you're more in active labor. But getting in the tub or in the shower can just be such a relief during labor and can really make a huge difference in pain management and just getting you through labor. So when you get in the birth tub, typically at the birth center I work out, we're keeping the tub at about 100 degrees Fahrenheit. So that makes it really safe for if a baby's born in the water, that the baby's going from being in body temperature to going to water that's a very similar temperature. So it's safe for them because they're not stimulated to breathe. So if you think about it, when they're inside the womb, they're in fluid, they're used to that warm fluid environment. So when they're being born into the water, then it's a very smooth transition. They're not stimulated to breathe unless the water is cold, or until they get up into the air, then they're stimulated to breathe. So being in the water can also be a really great option for pain management and you can do all sorts of different positions in the tub. So you can get on your hands and knees, you can rock back and forth, you can lay on your side, you can squat, you can just be in all sorts of different positions. So the tub is really awesome as far as a really good tool in labor. So let me go back to talking about the different stages in labor. So we got to the first stage, which is early, the second stage, which is active labor, and now you get from active labor into, the first stage is early and active. Now we get into the second stage, which is pushing. So that transition from active labor into the second stage, which is pushing, in the middle you have transition. So active labor, you go along, you're having contractions that are getting stronger, longer, and closer together every 3 to 4 minutes apart. And then a lot of times women get to the place around transition, which is typically 7 to 8 centimeters. They may start to feel really nauseated. They may get really emotional or feel like they can't do it. And this is normally kind of the turning point where their body is going from that active labor into transition, which then will result in an urge to push when they get to that 10 centimeters. So this is really important during this time to remember that if you start to feel like hopeless or discouraged or frustrated, or you're feeling nauseated, all these different feelings, or shaky is another one that I see a lot. If you're starting to feel that, really be encouraged that you're getting really close. And so typically once women get through that transition, they get to the point where they get into second stage, which is where they start feeling an urge to push. So second stage, it is really important to wait to push until you feel just like an overwhelming urge to push. And so what we'll tell women that I'm working with, what I'll tell women that I'm working with, is really to wait to push until they feel like they can't not push. So you will get to the point, at first you'll start to just feel like kind of pushy, like more pressure. You may feel, an urge to push. But you could also breathe through the contractions. So what I'll tell women is just to continue to breathe through the contractions, breathe through that pressure until they get to the point to where they're trying to breathe through and they cannot breathe through it anymore. Their body at some point will take over and they will just start pushing. So, and really, you can be in whatever position that you feel best when pushing. So, caught babies while women were standing up or in the tub or squatting or on the bed and sideline, and all different positions, really according to just what they feel is best. I think the position I see women most naturally choosing is to be on hands and knees. That's just the position that when I find that women are just left alone to kind of pick wherever they want to be when they're pushing, a lot of times they tend to roll onto their hands and knees to push. So that's a really great position to be in. But you can also be on your side. That's a great way if you're tired to push on your side is a great way to push. If baby's still kind of high up and you need more pressure, squatting is really good. Some women sit on birth stools, which is basically just a stool specifically designed for giving birth. It just has a cutout to where there's space for baby to be born. So really just choosing the position that you feel is right during pushing is really key. And you may be continually changing even throughout labor. One position may feel really good, and then in the next moment it no longer feels good. So it's just important to communicate what you need and to continue to just get in positions that feel right for you. So, and throughout labor, you may feel like you need support as far as like your back being rubbed, or hip squeezes can be really helpful, where someone is just squeezing your hips together. It takes a lot of pressure off your back. So always ask if you are wanting that support. I'm sure the people around you would love to give you that support. So if you feel like you're needing that during active labor, or transition or pushing during any of the stages of labor, really just asking for the support you need. Or if someone is trying to support you and it doesn't feel comfortable or doesn't feel good, just telling them like, no thank you, and nobody's gonna feel offended. Hopefully that that's not the support that you need in the moment. So back to pushing. So whenever you're pushing and you're able to really just wait until you get that overwhelming urge to push, you just have to push for so much less time typically when your body is working with you, when you're having good strong contractions, and when you're waiting for that overwhelming urge. Typically you're able to push out your baby pretty quickly. But sometimes for first-time moms, it does take a little bit more time, so don't get discouraged if it's taking you more time. It's nothing that you're doing wrong. It's just with your first baby, sometimes it takes a little bit more time to push them out since this is your first time and they're having to navigate your pelvis and your body is stretching and moving in ways it never has before. So really though, when you're pushing, you really want to wait until you get to what's called the peak of the contraction. So contractions don't just start off full force. They kind of build in intensity, get to the peak, and then they start to come down. So it is the best if you can, start when you're getting ready to push, waiting until that contraction builds, gets to the peak, and then that's when you're giving effort, when you're having the most help from your body. So you can push earlier, but you're having to do more work as a result of not waiting for that really strong part of the contraction. So if you can wait till it gets to that peak and then pushing with it, you have the most help from your body and the most pressure. And then really you want to push really into your bottom. So I see some women and it's like they are almost pushing with their voice. So it's like they're holding the sound up here, really high sounds, really like maybe even letting lots of noise out of their mouth, which is okay to make noise, during labor. But when you're pushing, you really want to focus on taking all of that sound, all that power, and pushing it all the way down. So it's like a really deep guttural feel and sound, and you want to push basically like you're having a bowel movement. That's the muscles that you'll feel pushing. Those are the correct muscles to use when pushing. And so you really want to, even you can picture just like going underwater is kind of the feeling that you'll get when you're taking all that sound and all that power and like down, feeling that downward sound. So that's how you want to push, all into your bottom, all that pressure, just pushing all the way down. And then when you feel the contractions stop, you can stop pushing, take a break. Typically contractions start to space out more when you're pushing. So in active labor, you get to the point to where they're one right after another every minute to 2 minutes. And then when you get into pushing, they may space back out again every 3 minutes or so apart. And that's basically your body's just giving you a little break, time to rest in between to then start that next contraction. So take advantage of those break periods in between pushing. But then once you get that contraction, try and just give a couple good pushes. So try not let that contraction get by, without giving some good effort behind it. So, but if you're not feeling an urge to push, you can always wait and breathe through that contraction and then go for it the next time. So, and then as you're pushing, as baby's getting lower and getting ready to come, you may feel what is described as the ring of fire. And that is as baby's head is coming and is on the perineum, you may start to feel like a burning sensation, stretching sensation, which is called the ring of fire. And it's really important that when you feel that, to just sink into that feeling. So don't be afraid of that. Don't back away from that. And sometimes I see women back away from that feeling because they're afraid of tearing. And really, when you're in a good upright position, when you're pushing intuitively, when you're waiting for your body to have that urge to push, and then when you're not being directed to push, but when you're pushing, when your body's ready to push, we don't tend to see a lot of tearing. So don't be afraid of that. Just try and sink into that and continue to relax, to let your tissues really stretch really well, and continue to just push when you feel those sensations, and try and keep your bottom nice and soft to just allow baby to come. So it's really important not to be fearful, and the less fearful you are, really, the better you'll do, because when you're afraid, you tend to get more tense, and then that causes more pain, and that pain causes you to be more fearful, which just starts a cycle of pain, tension, and fear. And so this is why it's really important to be well informed, to be in a place where you feel safe, to be with care providers that you feel well supported by, because really when you have that combination, then you're able to relax. When you feel well informed, when you understand what's going on, then you can just really relax into it and not be fearful of what's going on. So that makes a huge difference in even being able to relax. So yeah, and then as baby comes out, typically the head is born first, and then you may have a pause, and then the next contraction you'll have the body. And sometimes baby just comes all in one contraction, but a lot of times it is the head will come, you have a break, then you have the next contraction, and the body will be born. So that is very normal for there to be that break between the head coming and then the body coming. So sometimes as the head comes out, you may have your care provider may be checking to feel if there's a cord. So that is really normal to just check and feel and make sure. Really, it's not too concerning. If there is a cord, the care provider will just help somersault baby out of that cord, or just unloop the cord as the baby is being born. So that's nothing to be concerned about. So, and all throughout, as you go throughout labor, your care provider will continue to monitor your vitals and monitor baby's vitals, which is the heart rate. And so it's really important that as your care provider is trying to listen to baby's heart rate, typically midwives are using a handheld Doppler, and so that with that Doppler they're listening intermittently, and as you get closer to having your baby, they're listening more and more frequently. So it's really important to allow your care provider to listen, because that's how they know that you're doing good, that baby's doing good. So it's really important to let them listen and give them space to listen. And then if they're ever, asking you to get into a different position, or if maybe you're in the water and they, suddenly have some sort of a concern where they want to monitor more closely, they may ask you to get out. So it's really important to, just to have an idea of what your birth will look like, but also to not get so hung up in the details that then if any part of your birth changes, that you're discouraged or that you feel disappointed. So occasionally there's something that a midwife wants to monitor more closely, or maybe the water becomes like not a safe option for you, and that was something you're really excited to do. And so she may ask you to get out, and then you may get back in later. But it's just really important to just let labor unfold as it does, as it will, and to not get too hung up in the little details of, like, okay, I want this song playing when baby's born, and I want to be in this position and this exactly to happen. Sometimes that can really hold women up. Just having that really specific plan in their mind that really any change would disrupt that. That's kind of a hard place to be. So I would just encourage you, when you're thinking about your birth, to really know what you want, but also keep an open mind, and just allow labor to to unfold and not get discouraged if plans change or if things look differently, because ultimately the goal is for you and for your baby to be safe. And so if you pick a good provider, that's what the goal of your provider is as well. So just for a safe mom and a safe baby. So that is really important to keep in mind if you're being asked to get into different positions that maybe you're not wanting to get in the moment, or if you're being asked to do different things, or they want to monitor baby more closely, that really not allowing that to just, ruin your whole plan, but just to be flexible, to know that the goal is really a safe delivery for you and for baby. So once baby is born, typically the first thing we're doing is drying off baby and putting it on your chest, or holding the baby out and letting you pick up your baby, or some moms want to catch their baby, or maybe the partner wants to catch the baby. So that is a really important thing to discuss with your care provider. If you're wanting to do that, if you're wanting to catch your baby, to ask them ahead of time, like, is this something that you're comfortable with? Is this something that you do regularly? Because it can be really special to get to catch your own baby. So after you're having the baby, then your care provider will want to listen really closely to baby with a stethoscope, making sure that baby's breathing and has good stimulus and good muscle tone. So those are all things that your midwife is going to be checking for once baby is born. And then typically, sometimes midwives, if you're already in the tub, will have you deliver the placenta in the tub, but a lot of times they'll move you to the bed to deliver that. And that placenta is basically just the organ that has been supporting baby. So that's how all the blood flow has been traveling to baby through the umbilical cord. So a lot of times what it looks like is, if you deliver in the tub, the midwife will get you out and get you onto the bed while baby's still connected to you with the cord. So they're doing delayed cord clamping. Which, if you don't know about delayed cord clamping, it's really important. Up to a third of the baby's blood is still in the placenta at the time of birth. So when you're cutting the cord early, you're leaving all of that blood of the babies behind in the placenta, and it's just a much rougher start for them. And the placenta is full of stem cells, which are really important in a healthy, long life. So delayed cord clamping is amazing, and it really also keeps the mother and baby together. So if you're, leaving the placenta connected to the baby to allow that blood flow to transfuse into the baby and allow the stem cells to move into the baby, probably other family members aren't going to come and want to grab the baby and take the baby away from the mom. So which is important, because the mom and the baby need to be together, need to be skin to skin. That stimulates the mom to, start producing that colostrum, which is that first rich milk for the baby. It stimulates the baby to want to suck and to nurse. It helps regulate the baby's temperature. It helps baby start with breathing motions, just being on the mother's chest. It keeps the baby warm. So it's really important that after the baby's born, to keep the mom and baby together. And it's just so important for bonding. So then after that point, after you have the baby, after you get settled, then it's really important to start nursing. So nursing is really such a wonderful thing. Like I said, it helps bond the mom and baby. The mom is really making the perfect concoction for her baby. So the first milk is that colostrum, and it's very high in antioxidants, and it's basically nutrient dense. So it's not, the mom won't get that, like what we think of as milk, that creamy, thick white milk, until maybe about day 3 to 5. But in the meantime, she makes colostrum, which is nutrient dense and is all the baby needs in that first time of life. But nursing just prevents so many diseases in the mom later on in life, like breast cancer. It helps fight against that, and for the baby helps prevent a ton of different sicknesses and diseases. It helps reduce like the occurrence of asthma and really diabetes, different common struggles. So that is really important. It's really important that the mom will nurse the baby in those first couple weeks of life every 2 hours around the clock. So that will allow her milk to come in sooner and will keep the baby really nice and hydrated. So that is really important to do. So, and then a lot of the times after birth, your midwife will be giving you an herbal bath if that's something that you're interested in. So this typically happens few hours, 3 to 4, maybe more hours after the baby's born. Your midwife may offer you an herbal bath, which is basically just a really nice bath of different herbs that is really comforting for you. It's really helps heal your tissues and your perineum. And it's a chance where you can get back in the tub, you can clean up your baby, you can sit and check your baby out and look at your baby. It's just a really sweet time. And then your midwife will also be doing a head to toe newborn exam on your baby. So just checking out your baby head to toe, making sure that everything looks good. Your midwife, you may feel her rubbing your stomach to control bleeding, to make sure what she's doing is making sure that your uterus, which was all the way up here and big, is shrinking all the way back down to its normal size. So after birth, it feels like a grapefruit, like this, inside of your stomach. So you feel your uterus is hard and just above your pubic bone. So you may feel her rubbing in a motion like this to get your uterus to become firm, and that may not be super comfortable, but it's really effective in helping to control bleeding, and frequent nursing will also help control bleeding. So you may feel her do that. And then after the birth, your midwife will give you really good postpartum instructions for you and baby, and it's really great to get those instructions, both written and verbal, so you feel well equipped to take your baby home and care for them and make sure that you're doing good in that postpartum period and that the baby's doing good. And then typically midwives are seeing you either the next day, 24 hours later, or in 48 hours. And then on a scheduled basis after that. How we do it, we call you at day 1, and then we have a postpartum appointment with you at 2 days postpartum, 2 weeks postpartum, 6 weeks, and then some midwives offer a pap smear at 12 weeks. So that's typically what care looks like afterwards. So anyway, so that is a really good synopsis of just what labor will look like, what coming to the birth center will look like. It's not an all-inclusive childbirth class by any means, but it is kind of a good overview just to kind of wrap your head around what natural birth looks like and kind of what to expect. So thank you for listening, and I hope this was helpful for you today.